Climate change from excess carbonization bears impact on human health, from extreme heat resulting to stroke and cardiovascular events, floods, droughts, vector and waterborne diseases. It also threatens the infrastructure of health systems and the management of public health. So, decarbonizing health systems therefore would result in an ideally responsive, healthy and relevant constituents that can cut the cycle of environmental diseases, producing a healthier community that thrives in a dynamic climate, especially here in Southeast Asian region.
Southeast Asia is admittedly one of the most susceptible regions to the effects of climate change. We've encountered stronger typhoons, intense drought, and the continued rising of the average temperature of the region. As the environment is an important contributing factor to disease and mortality, the healthcare sector is gravely affected by these changes. A decarbonized and climate resilient healthcare system would entail a more sustainable and adaptable future. It would not only positively affect the healthcare system in terms of better preparedness, accessibility of services, higher quality of care, and better affordability, but it would also empower healthcare facilities to be more environmentally conscious and sustainable. Health and climate change are not straight parallel lines but a tangled web. Let us come together and save our Earth and our population for a better and a healthier tomorrow.
Hi guys, my name is Nadia from Malaysia. Climate impact is no longer the story of the future, guys. Southeast Asia is already one of the hardest hit region. For example, in Malaysia, heat waves are more frequent, causing chaos in the human health. Morbidity is wide-scale and long-term, seen in the elderly, children, women, and those with existing chronic diseases, and thus adding pressure on the health sector. Social inequities already exist in the society, if not addressed, can further contribute to heat susceptibility. For example, often marginalized migrants working in the construction sector are affected by direct heat. Farmers facing increased heat stroke and yield loss threaten their livelihoods, and in the long run, so does our food and nutrition security. Extreme weather events also disproportionately affect rural women. Loss of traditional herbs and medicine caused by extreme weather events threatens the culture and the identity of indigenous people, and in some cases, women's access to sexual and reproductive health care. Friends, we need to urgently address the health sector's capacity to adapt to climate impacts. A health crisis is a climate emergency. Regional collaboration must share best practices, and from the private sector to the grassroots level. And this framework is one of the interventions that we urgently need to get us there. Thank you.